This is a muscular anatomy review of the elbow with focus on the muscles that act upon the elbow. As a review, the motions that occur about the elbow include flexion, extension, and then supination and pronation, which are occurring at the radio-ulnar joint. Beginning anteriorly, we will look at the muscles that perform elbow flexion. These include the biceps brachii, the brachialis, and the brachioradialis. Beginning with the biceps brachii muscle, we previously talked about its origins at the shoulder in the shoulder muscular anatomy review. But just as a reminder, the long head of the biceps brachii has an origin on the supraglenoid tubercle of the scapula, and the short head of the biceps brachii has an origin on the coracoid process of the scapula. Collectively, the biceps brachii has one insertional point, seen here. The biceps brachii inserts on the radial tuberosity here. And because of its orientation, the action of the biceps brachii is to perform elbow flexion, assist with shoulder flexion, and then perform forearm supination. The biceps brachii is innervated by the musculocutaneous nerve, and it receives its blood supply from the brachial arteries. If we remove the biceps brachii, beneath it, sitting right against the anterior surface of the humerus, is the brachialis muscle. The brachialis has an origin on the distal half of the anterior humerus, and it inserts primarily on the coronoid process of the ulna. It also attaches a little bit on the sublime tubercle of the ulna, just distal to the coronoid process. And if we remove our common flexors, you can see that insertion there on the coronoid process here and the sublime tubercle just distal to it. This is also the attachment site for the anterior oblique band of the ulnar collateral ligaments. The brachialis receives its innervation from the musculocutaneous nerve and its blood supply from the brachial arteries and a recurrent branch of the radial artery. Lastly, sitting lateral to the brachialis muscle is the brachioradialis. The brachioradialis has an origin on the lateral supracondylar ridge of the humerus, just superior to the lateral epicondyle. And the brachioradialis inserts, which is not visible in this prosection, on the radial styloid process of the radius, just proximal to the wrist joint. The action of the brachioradialis is to flex the elbow, and it also may assist with forearm supination and pronation. The brachioradialis is innervated by the radial nerve because of its lateral orientation, and it receives its blood supply from the recurrent branch of the radial artery. Looking next at the extensors of the elbow, we have two primary muscles that are responsible for extension of the elbow: the triceps brachii and the anconeus. Beginning with the triceps brachii, this muscle has three origins. For its long head, the infraglenoid tubercle of the scapula. Its lateral head originates on the posterior surface of the humerus, just superior to the radial groove. And its medial head attaches on the posterior surface of the humerus inferior to the radial groove. So it's a little difficult to image all three of them, but let's see if we can do that here. Okay. So we have the long head attaching onto the infraglenoid tubercle. We have the lateral head attaching superiorly on the posterior aspect of the humerus. And it's not quite visible because it's deep to these, but the medial head attaches a little bit more inferiorly on the posterior aspect of the humerus. Collectively, the triceps brachii inserts onto the olecranon process of the ulna here. And because of its orientation, the triceps brachii has the actions of elbow extension and weak shoulder extension. Remember, the latissimus dorsi is a much stronger extensor of the shoulder. The triceps brachii is innervated by the radial nerve, and it receives its blood supply from a branch of the brachial artery. If we remove the triceps brachii and zoom in to the posterior lateral aspect of the elbow, you'll see the other extensor of the elbow, the anconeus. The anconeus has an origin on the lateral epicondyle of the humerus, and it inserts on the olecranon process and the posterior surface of the proximal ulna. It acts to extend the elbow, and similar to the triceps brachii, is innervated by the radial nerve and receives its blood supply from a branch of the brachial artery. Lastly, we will take a look at the forearm muscles that act upon the elbow to cause supination and pronation. These muscles include the supinator, the pronator teres, and the pronator quadratus. Beginning laterally, finally, we will take a look at the forearm muscles that act upon the elbow to cause supination and pronation. Beginning laterally with the supinator muscle, this muscle has a broad origin attaching onto the lateral epicondyle of the humerus, the radial collateral ligament, and the annular ligament. In this cadaver, the supinator muscle actually doesn't have any fibers that cross the elbow joint to the lateral epicondyle. However, you can see its attachments onto the lateral collateral ligament and the annular ligament. The supinator muscle inserts on the proximal third of the radius, and its primary action is to supinate the forearm. The supinator muscle is innervated by the radial nerve, and it receives its blood supply from the ulnar and radial arteries. Looking medially, we have the first of our two primary pronator muscles, this being the pronator teres proximally. The pronator teres has an origin on the medial epicondyle of the humerus, and it also has a slip, as you can see from the posterior aspect here, onto the coronoid process of the ulna. The pronator teres inserts onto the lateral surface of the radius, approximately halfway down the shaft. And the pronator teres has the collective action of pronation of the forearm, and it assists with elbow flexion because it crosses the joint. The pronator teres is innervated by the median nerve, and it receives its blood supply from the ulnar artery. Lastly, and this is a pronated forearm, so we're going to flip it over. Along the distal aspect of the anterior surface of both the ulna and the radius, we see our pronator quadratus, which is so aptly named because of its square-like shape. The pronator quadratus has an origin on the distal fourth, if you will, of the anterior surface of the ulna, and it inserts onto the distal fourth of the anterior surface of the radius. So it runs from the ulna to the radius in this orientation. Its action is to pronate the forearm along with the pronator teres. And similar to the pronator teres, the pronator quadratus receives its innervation from the median nerve, and the pronator quadratus receives its blood supply from the ulnar artery. Although pictured here, we will talk about the flexors and extensors of the wrist and fingers during the wrist and hand module next week. For now, please note that attaching onto the medial epicondyle, collectively, we call this mass the common flexor pronator group. And laterally, attaching onto the lateral epicondyle, we collectively call this group the common extensor group.